Uterine polyps are very much common in our practice. What are uterine polyps? What do they cause? Do they affect fertility, or are they a factor in infertility treatment? Do uterine polyps need to be removed? What is the mode of removal? What kind of surgery needs to be done? Do uterine polyps disappear by themselves? Is surgery necessary for uterine polyps? Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. Today we will discuss a very short and sweet topic of uterine polyp. So what are uterine polyps? Uterine polyps are basically some small masses which are present in the endometrium of uterus. And they may sometimes act as a foreign body in the uterus and prevent the implantation of embryo, and that is why uterine polyps are very, very important. Apart from infertility, that means prevention of implantation either in IVF or in natural cycle, they may also cause something called as an intermenstrual bleeding. In few females who have got normal menses and then they again get sometimes menses between their menses, uterine polyp is something which we need to look at. Do these uterine polyps affect fertility? Yes, they definitely do affect the uterine fertility. First of all, like I have mentioned in my previous videos, you have to understand what is the mechanism of fertility, how the fertility occurs. This is the vagina, this is the uterus, this is the fallopian tubes, and this is the ovaries. From ovaries, the follicle ovulation rupture. Ovulation occurs, the follicle ruptures. From rupture, follicle is picked up by the femoral end of the fallopian tube. The picked up ova from on the cilia, top of the cilia, goes inside the fallopian tube. The semen is deposited here in the vagina. From vagina, it crosses cervix. From cervix, it goes to the side of the fallopian tube, and the fertilization occurs in the fallopian tube. After a couple of days till cleavage stage, after 3 days of fertilization, the embryo comes to the uterus and then it gets implanted here. So if there is a polyp inside the endometrium, then it may affect the implantation. So uterine polyps definitely do affect the fertility. How the uterine polyps affect fertility? Again, I have explained. They basically prevent the implantation of the incoming embryo from the fallopian tube in a natural cycle, or if we are doing an IVF, if we are depositing an endometrium, they may prevent the adhesion of embryo to the endometrium. Are polyps serious in nature? Most of the polyps are benign in nature. They do not cause serious problems. The only irritating problem is they may sometimes cause intermenstrual bleeding. How the polyps are diagnosed? No patient would come and tell me directly कि sir I have polyp. They would not know it. If whenever we do a transvaginal ultrasound, we basically can diagnose them very easily. Anybody can diagnose polyps on ultrasound, and for confirmation we can do a saline infusion sonography, or we can go do a hysteroscopy. Hysteroscopy for diagnosis of polyp is not recommended. Ideally, if you are taking the patient for a hysteroscopy, it should be for the removal of the polyp. Are polyp symptoms of PCOD? Now one has to understand it. What are the causes of polyp? Sometimes patient may have taken a medical termination of pregnancy pill in past. Patient may not have done an ultrasound to confirm whether all the products of conception are removed or not. Once the patient gets bleeding, female thinks that everything is removed. Sometimes few small millimeters of products or few small centimeters of products are there, and over a period of time they get absorbed slowly, but they form a polypoidal or a small mass-like structure, and then they become polyp. In PCOD patients, there is an unopposed action of estrogen, low-grade estrogen, because of the multiple small follicles. The endometrium is big, and sometimes the endometrium in the cavity folds on itself and it gives an appearance of polyp. But because of this, On ultrasound, it appears that there is a polyp because of the excessive growth of endometrium. What size of polyp causes infertility? Now, this is very, very important. On an ultrasound, especially the polyps are not visible on day 2, day 3, but they are mainly visible on day 10, day 11, when the normal endometrium forms, and polyp is very clearly visible as an echogenic spot in the cavity of endometrium. I have seen patients 5 millimeter by 5 millimeter or 6 millimeter by 6 millimeter polyps. Patients, they do conceive with polyp also. If polyp is more than 1 centimeter in size, then possibly it warrants a removal. See, if I diagnose a patient of a infertility on first time that there is a polyp in the uterus, and patient is of young age, patient has not been trying for long time, then I won't be advising the patient to get the polyp removed in the first visit itself. What I would do is, I would wait for 6 to 8 months and then see how it goes. If all the other factors, fallopian tube is normal, husband semen count is normal, the age is okay, the hormones are normal, then I would give a reasonable try of controlled ovulation, controlled ovarian hyperstimulation along with timed intercourse, and then we'll see if within 7 to 8 months or 9 months the patient does not conceive, then I may possibly think of removing the polyp. Otherwise, a small 6-7 millimeter polyp does not require a removal. Having said that, if it is more than 1 centimeter, again we may try for a couple of months normal. If the patient does not conceive, then we may advise for the removal of polyp. But again, like I said, only polyp on an ultrasound is not the indication for the removal of polyp. Can one get pregnant with polyp? The answer is very definitely yes, one can get pregnant with polyp. But sometimes what happens is, if the implantation occurs on polyp, then there are increased chances that either the pregnancy may not grow, or there may be bleeding in pregnancy, or there may be a miscarriage. So again, like I said, if polyp is there, it basically acts as a foreign body. If the embryo is implanted half on the endometrium or half on the polyp, because the embryo gets blood supply from the endometrium, the portion where the embryo is implanted on the polyp, that portion may not get the blood supply, and as a result the embryo may not grow, the fetus may not grow properly, and may end up, the pregnancy may end up in miscarriage or bleeding. So a small polyp may not matter, but if it is more than 1 centimeter, the pregnancy may definitely, there are more chances that pregnancy may miscarry, especially if the pregnancy is implanted on the polyp. Now, nobody knows where the pregnancy may implant. Usually pregnancy implants in the upper half. If the polyp is in the lower half, then it may not cause miscarriage as such, but if the polyp in the lower half may act as a foreign body, so it may prevent the passage of sperm to the endometrial cavity to the cornu, or it may prevent the union of the two gametes. Can polyps be removed without surgery? Answer is definitely no. Polyps cannot be removed without surgery. There are two ways in which we can remove the polyp. One is a plain DNC, dilatation and curettage. Other is a hysteroscopic guided polypectomy. Now, what do we do in DNC, dilatation and curettage? Dilatation and curettage is a blind procedure. By blind procedure, we mean to say that we do not see what the uterus looks like outside. Outside, we just see the cervix. We dilate the cervix, put a curette inside, and from our knowledge, we curette all the walls, two lateral walls, anterior wall and the posterior wall, and the fundus, and wherever the polyp is, then we remove it. We do a pre-DNC or a pre-polypectomy transvaginal ultrasound. We also do a post-polypectomy ultrasound, and in most of the cases, the polyp is removed. In hysteroscopy, we directly put a camera inside the uterine cavity. Like I can see you, like I can see other things, we can directly see the polyp in the cavity. We take either the serous or a monopolar cautery and we cut the polyp, and then it can be removed. Which is a better method of a polyp removal? In an ideal world, hysteroscopy is a better method for a polypal removal. The efficacy of both the methods is same. But in an ideal world, hysteroscopy is a better method of the polyp removal because not only the polyp will get removed, we'll have a good look of the endometrial cavity. We can look at the quality of endometrium, whether it is pale, pink, dark pink, yellow, any tubercles are there. And we can also have a look at the cornu if the cornu is narrow, cornual stenosis is there. We can look for the septum. If septum is there, we can correct the septum. If there is a narrow cavity, if the lateralization of cavity needs to be done, then we can definitely go for hysteroscopy. If the patient for some reason requires IVF, patient is 35 years age, patient has multiple miscarriages in past, then rather than going in for a blind procedure like DNC and polypectomy, it is better to go for a hysteroscopy. Hysteroscopy, like I said, in most of the cases we do a pre-IVF hysteroscopy, and in that cases if polyp is removed, it gives us more chances of success of IVF and embryo transfer post the IVF. So again, there is no single answer. Does polyp need to be removed in all the cases? Again, it depends upon the case, the age of the patient, how long have they been trying, what previous treatment patients has taken in the past, what is the reports of husband, what are the hormonal reports, what are the fallopian tube studies and all those kind of things. So I have tried to summarize what can be done. Any medicines to shrink polyp? Unfortunately, there is no medicine which can shrink the polyp. How to remove polyp? I have mentioned DNC or a hysteroscopy. Can polyps be removed naturally? Unfortunately, till now I do not know of anything that polyps can be removed naturally, unless the polyps are because of past MTP pills taken and in subsequent cycles they may get removed, but the chances are very less that they may get removed naturally. Do polyps grow back after removal? There is a decent chance that polyps may grow back after removal, especially in cases of gross polycystic ovarian disease. But if the polyp is because of MTP pill, unless the patient has taken a repeat MTP pill, I don't think that polyps may grow back again. Will periods be normal and regular after polyp removal? See, if polyp is causing intermenstrual bleeding and polyp is removed, then it is most likely that periods may become normal. The intermenstrual bleeding because of the polyp may go away. But as the patient ages, patient crosses 30, 31, 35, as the AMH goes down, then the irregularity of period increases, and that has got no relation with the polyp, to say the least. Does polyp removal increase the chances of fertility? If patient is desiring fertility or pregnancy and for some reason patient is not conceiving and all the other reports are normal and patient has tried for a significant amount of time, 8 to 9 months, and then still the patient is not conceiving, then we may think that polyp may be acting as a foreign body and that may be impairing the fertility, and in those cases there is a decent chance that removal of polyp may increase the fertility. And especially for some reason, like I said before, patient wants to go for IVF, it is better to go for a polypectomy with hysteroscopy. Will uterine polyps grow back after removal? I have mentioned again, there is a decent chance in gross polycystic ovarian disease with no treatment that polyp may grow back again. Is IVF required for polyps? Per se, if patient has only polyp, there is no other thing. Husband semen analysis is normal, fallopian tubes are normal, hormone reports are normal, there is no fibroid, the uterine factor is normal, then only polyp may not require IVF. But if there are more than couple of factors, see patient's age is more than 30, 31, 32, they have been trying for long, there is a history of multiple IUI failures or previous IVF failures, then in that case, in consultation with the patient, IVF may be required. So this was our small session about polyp. There are lots of questions which can be taken. You can ask those questions, you can comment. A request, please like the video, share the video and subscribe to our channel. Namaskar, bye bye.